Hi, everyone. Welcome to today's Stanford Live. We are so excited today. We are chatting with our oncology department. We have Lichelle Crew, who is the patient care manager over our C2 medical oncology unit, as well as Casey Shade, who is our assistant patient care manager over on the oncology hematology E3 unit. We're just really excited to learn more about what all oncology encompasses, and Lichelle and Casey are here to answer your questions today. For those of you that have thought about working in oncology, working at Stanford, just getting some of those questions answered that you don't when you're going through the application process. So to get us started, I'd like to introduce Lichelle Crew and have her tell us a little bit more about herself.
Hello, everyone. Good morning. My name is Lichelle Crew. I am the patient care manager for C2. C2 is a medical oncology unit. We are transitioning from a medicine designation towards oncology. And so we have a total bed capacity of 25 beds. We have on staff roughly about 69 members of staff. And we do have a lovely team through and through. I started my Stanford journey here in January of 2022, and so far it has been great. I really love the team spirit. I really love the resources that I can pull on from day to day in terms of my communication line with Carly and Jennifer and my colleagues. I can say that we really have something special going on. And so I am very proud to be a part of such a team. We are leading our staff towards an increased training capacity. And so far, we really have our hands full, and we would like to engage each and every one here in terms of what our staffing looks like, what our staffing pattern looks like, what our training engagement looks like, and so forth. I try to say to my staff, get to know me as a person before we start off with our leadership colleague arrangement. And so far that has been working well. I think my staff feels very comfortable coming up and chatting, from patient care issues to personal issues. We do have that open line of communication going on. I think so far, we want to set a culture that is quite engaging and set an expectation that is quite open and engaging, because we recognize the heart and the work that we do from day to day. And so we want to set that tone and, share that experience, not just with the patients, but with our staff alike. I started my nursing journey at the age of 17. I went straight into nursing school from high school. And so nursing really has been my bread and butter, if you may, for all these years. And going through the nursing profession, I am still engaged and proud to call myself a registered nurse, even though I'm performing a little bit more administrative duties. I still consider myself a nurse at heart, and so it's not uncommon to see us. And I'm sure Casey can attest to this too. It's not uncommon to see us, chipping in at the bedside and giving a helping hand. And so we want to share our experience, and we want to thank you for joining us. Thank you so much. I think I'll hand over to Casey to introduce herself.
I did the mute thing. Hi, good morning. I'm Casey Shade. I'm the Assistant Patient Care Manager of E3, our Hematology Oncology Unit here at Stanford Healthcare. We have 20 sick bed capacity, and we serve patients that mainly have solid tumor and leukemia and lymphoma. We have a little bit of leukemia overflow here and there, and a little bit of medicine overflow. I've been in my role for about a year or two. Prior to that, I was a bedside nurse. And prior to that, I was actually a traveler at Stanford Healthcare. So I came to Stanford not really knowing what to expect, but fell in love with it quite quickly and haven't left. I really like oncology. I've done oncology all of my career. The beauty of it is you get to develop more long-term relationships with your patients. A lot of our patients are quite sick and stay here for an extended period of time, or they come back for their recurring chemo, or they come back for various issues. So you really get to build connections with people that you maybe wouldn't get to in other areas of nursing. I think the team really prides themselves in the care that they provide for their patients. With those connections, informs sort of a greater involvement in your patient care and a greater commitment to taking care of your patients. Nurses are tough. This is certainly not for the job of faint of heart. I know, we knew that before COVID, and we certainly know that after COVID. And I think oncology nurses breed a sort of a tougher a tougher nurse. You see the ups and the downs of a person's life. And, a lot of people think oncology is scary or, has a lot of sadness, but I think it also has a lot of beauty and a lot of life. And I think who we are as a nurse informs who we are as a person, and who we are as a person informs who we are as a nurse. So it gives a little more value to the life that we get to live. And, we see patients go through ups and downs, ins and outs. And I think patients' resiliency informs our resiliency as nurses. And I think, oncology patients really don't take for granted life. Every day is a gift, and everything that we can engage with or seize the day is an opportunity. I think our staff pick up on that and sort of partner with our patients in how to embrace life. Our team goes above and beyond for our patients. When a patient finishes their chemotherapy, we gather around and sing them a song. We have patients ring a bell. We have patients and nurses do artwork together. We really pride ourselves in wellness, resiliency, and we have a big crew of staff that just have such a creative bug. So we have a big art poster that staff and patients get to color together. So, it's not a place that we just come in, do our work, clock in, clock out. It's a place that people really look forward to coming to work, and they really look forward to seeing their patients and continuing that wonderful care. Thank you.
Thanks so much, Casey. Well, I guess we can just kind of dive right in. So a lot of times oncology encompasses so many things, and we have two separate units here. So I wanted to dive a little bit in, Lichelle and Casey. Lichelle, we can start with you. Being a medical oncology unit, what does that mean? What type of patients do you guys tend to see within your unit?
I'll start first. Thank you so much, Carly. I think for us, C2 is in a unique position because, as I mentioned earlier, we're transitioning from a purely medicine designation towards oncology. So we do have quite of a mixture of patients. We do see some medicine overflow patients coming to our unit, as well as we see those solid tumors coming over. And so in particular, we'll find patients who needs GU interventions or have GU aligned cancers, GI cancers and so forth coming to our unit. And with the caveat that we might have maybe a handful of medicine patients to service. And so what that does, that wide range of patient population does allow us to be flexible in terms of our nursing skills. So in any particular day, we can see patients who probably require a TIP protocol or methotrexate or Rituxan or something of the sort. And while within that same space, we could be caring for someone who has pneumonitis or someone who has a cardiac issue or someone who needs that special medicine attention. And so I think where we are now is quite unique. I know Casey's unit is a little bit more established in terms of having a designated oncology population, but we take the joy in the transitional period. We take the ups as well as the downs, and we do recognize that within it all, we're strengthening our own nursing skill set, and we're developing a stronger workforce through and through.
Thank you, Lichelle. Yeah, I think, there's different populations and there's a bit of fluctuation. My unit does specialize a little bit more with lymphoma and solid tumor patients. We do get, some BMTU, some leukemia, some medicine overflow. Most of our patients are coming in related to complications of their disease or complications related to their treatment. So we get a lot of sepsis, we get a lot of infections that present in different ways. We get patients coming in that require inpatient chemotherapy. We get patients that come in that have tumor progression, so maybe further organ involvement or pain or lab abnormalities. So we do get a bit of a mix. I think it is nice to get the variety too, because as Lichelle said, you learn from different aspects of nursing, and it does sharpen your skills. We do get patients on telemetry. All of the inpatient units here at Stanford are acuity adaptable, so we can take patients of a higher acuity, and then we adapt the assignment based on those patients' acuity or the patient's needs. But there is a lot of education surrounding these different types of populations. We have a wonderful Center for Education Professional Development. We have clinical nurse specialists. We have unit educators. So there's a lot of resources to learn about the different patients we take care of, so we can take care of them better.
Thanks so much, Casey. So that being said, Casey, you struck a point with the AUs. We have the higher acuity patients. So in this day and age, obviously, there's a higher burnout going on with nursing just across the board. We've been through a pandemic. Here at Stanford, we also opened a new hospital right before the pandemic hit. There's just so many contributing factors to it. And then when you get into an oncology unit, you're met more with, unfortunately, the super sick and at times death. What are each of your units doing to kind of help your nurses get through those harder days? How do you help bond with those patients and obviously their families, because they become like a family on your unit? Do you guys do anything special to, celebrate maybe birthdays or anniversaries because they're in the hospital during those special days? Casey, I'll start with you since we kind of keep going to Lichelle first.
Yeah, no problem. That is a great question. And many questions in one question, so I'll do my best to answer. As I said, we get very close to our patients. So if there's a birthday or an anniversary, the staff get really creative. We have one patient that loved the Warriors, and their birthday, they would be in the hospital for a long time. So staff came with like the Warriors pom-poms and bought her a blanket, and they had like the Warriors game on, and it was just so engaging. We do have weddings here at Stanford. So we've had weddings before for, patients that maybe couldn't go to a family member's wedding or something like that. Like I mentioned, when a patient finishes their chemo, we do a wonderful celebration for them. If a patient is at end of life, we do have a palliative care championship team embodied by nurses, and the patients and the loved ones will receive a care box. And in that care box, they have different items that are attentive to our different senses. So there's a little candle for some light. There's a lavender pouch. There's some tea and candy. There's lotions that the loved ones can rub on the patient's hands and feet and just provide them a little bit more comfort. In terms of our nursing wellness, like I said, nursing is certainly not for the faint of heart, nor is oncology nursing. And we really take that seriously here. Burnout is a nationwide challenge. And I think, it's a word that we're used to using because so many people use it, but we really need to understand, why are you burnt out? What does that mean when I say I'm burnt out? So it's something that we circulate in conversation regularly. We actually established a wellness committee to sort of address this need. I think who can speak better to the needs of the staff than staff themselves. So it's made up of our nurses, nursing assistants, unit secretaries, and the wellness committee. They meet and they develop bonding activities outside of work. If a nurse is going through a tough time, or maybe someone's passed away, they'll band together to write a card for a patient or for that nurse, and sort of, meet them a little more on what they need. They organize different wellness activities. If someone's having a baby or bought a house, we'll have a potluck or a party. We do what we call muddles, so a mid-shift huddle. And with that, we do a little check-in, and we address any patient safety concerns, any staffing changes, any hotspots, things like that. And then at the end of the muddle, we do a wellness activity. So we either do a meditation, we have spiritual care come and give blessings, we do some stretching. So it's just a beautiful way to sort of mid-shift, pause, reset, sort of see how your day is going, and then give that back for yourself. We all work so hard to take care of our patients for 12 hours, even longer a day. So just taking a little bit of time to remind us to take care of ourselves is really important. We also have a buddy system. So your buddy checks in with you throughout your shift, not only to see if you need any help with your patients, but to also see if If you need help with taking care of yourself, like the buddy reminds each other, did you take a water break? Did you take your break? Can I do anything for you? So it's just a really great way to kind of keep engaged with your peers and your coworkers. We're here for our patients, but we're also here for each other.
Boy, Casey, I think you said it all, but I'll just go ahead and emphasize some of the points that were mentioned. I think for us as a management group, it's quite imperative for us to be aware. And that's where it starts, I think, in terms of building staff resiliency and preventing burnout. Our management team tries to be very in tune and aware with the happenings of the unit and with our staff. And so, for example, for myself, my door is usually very open. And so, if there is an issue or something that we need to resolve, the staff feels quite engaged and quite comfortable coming in real time to discuss such issues and to see what we can do to really prevent the obstacles and the barriers to patient care or to delivering optimal patient care. And that model really works for us. I think so far our staff feels quite comfortable like coming in and expressing how their day has been. And I think that outlet does provide them the conduit to let it all out. And we're really satisfied with that model, and we really feel empowered to improve that communication line of development between ourselves and the staff. I think too, as management or as the management team, we try to be quite involved. And we try to know our staff inside out. And so, for example, a couple of weeks ago, I saw one of my staff, within the hallways of the unit, not looking his usual cheerful manner. And so I checked in to say, hey, what's going on? Is everything all right? At that point in time, he shared, the challenges that he was going through. And so it was a prime opportunity for us to refer him to the services that we have. For example, the employee assistance services that we have, that is a part of our benefit package here, where the staff can really utilize the services of counselors, whether it's financial counselors, legal counselors, and so forth. That avenue does exist. And so we try to route our staff through those avenues, if you may. We try to allow our staff to utilize all the resources that we have to their advantage, to their full advantage, if you may. And with all of that, we really emphasize being alert, being present, and being in tune with the needs of our staff. And we believe once our staff has the capacity to express themselves, and if they feel that we are taking care of them, then we see, that excellency in care delivery as well. We too share the sentiments with Casey as it relates to seeing a whole lot of death and dying, and we do see that final end of life activity with our patients. And so we try to connect with our patients as much as we possibly can. We try to tend to their needs in a tailored manner as much as we can. We provide as much as possible in terms of visitation and in terms of giving them, their preferred comfort food. If it is that they have a preferred request, we try to honor it as best as possible. And we do recognize that being there to the end really matters, and being present in that human form, not just in the form of a professional, but in the form of a caring, compassionate person, does make the difference. And to that end, we feel satisfied when we have given our best, and we know that this serving really is what the patient needs. This service is what the patient needs, and the patient really does feel satisfied with how we show up in their space and how we care for them and how we really stop to listen and to address their needs as a whole.
That's awesome. Thank you, Lichelle. And I see we're getting questions within the chat between experienced nursing and new grad nursing. So I wanted to start with experienced nurses. So Lichelle, I'll start with you, and then Casey, if you want to piggyback on. For your openings that you currently have available, Lichelle, what are you looking in a candidate? Is there a certain experience that you're looking for? Is there certain certifications? What makes an ideal candidate for you when you see the application that you're like, yeah, this looks like a great fit for a unit? Or when you're interviewing a candidate, what just kind of clicks to where you're like, this would be the perfect nurse to add to my unit?
Good question, Carly, and I'm glad you mentioned the word ideal, because sometimes we might have an ideal preference, but based on what we really have in front of us, we have to work with the candidates and their pool of expertise. And so ideally, we're looking for seasoned nurses who do have the skill set, the competency, and the confidence to handle the patient population. And so we're looking for persons who may have experience handling chemotherapeutics, whether it's an irritant vesicant, whatever it is that you might be exposed to. We're willing to sift through it. We're willing to consider your background in terms of dealing with the oncology population. And it doesn't have to be specific to hanging chemotherapy, because we recognize that's just a small subset of what the nurse's job entails, right? And so we recognize that we may have interactions with a patient who has just received a cancer diagnosis. So we might be might be at a stage where we're mapping the treatment plan, and then we do have that therapeutic intervention phase. And two, we have to consider their ability to take care of the side effects, right? Symptom management is also a big part of the oncology care that we want to offer. And so not just having the ability to hang a chemotherapy, but to have that overall well-rounded experience in terms of dealing with an oncology patient from the start of the diagnosis to recovery or to end of life. And that's really what we're looking for. In terms of certification, we really would want to juxtapose or qualifications to that of the national level. And so the Oncology Nursing Society OCN certification is the gold standard for us. We do recognize that there is an opportunity to have a chemobiotherapeutic provider card, which we really would prefer our candidates to come prepared with. We really wouldn't want to limit each candidate to a particular set of experiences. And so if it is that the candidate has partially what we're looking for, but does show the tenacity, the resilience, and does show the interest to learn and to be compassionate and to really deliver care within that caring science model that we do endorse here at Stanford. That is also something that really excites us, because the truth of it all is we can always teach a skill. From sun up to sundown, we could train and we could expose our staff to really the standards that we're looking for. But when it comes onto caring from the heart, that is something that's quite innate, and that is something that's deeply entrenched in the individual's personality. And so we look at the sum total of the profile, not just the oncology experience, not just the training or the certification, but we also look at their life experiences. We look at how they've cared for persons before and how they've dealt with challenges. And if it is that they have a conflict, what tools did they use to overcome those barriers? And so we're willing to train, we're willing to meet persons where they are and bring them to the standard that we want to see.
That was such a great explanation, Lichelle. Well, I will do my best to tag off. But yeah, I think, the ideal candidate has their chemotherapy certification through the Oncology Nursing Society. They have their OCN, Oncology Certified Nurse. Not everyone can necessarily qualify for those things. We do love hiring experienced oncology nurses, but like Lichelle said, we also love hiring people that don't have oncology experience. It's a beautiful field. And I think, if you come in with different experiences, it informs who you are as an oncology nurse. I think other things that we do require here at Stanford is that you're ACLS and BLS certified and you have your active California RN license. I wrote down a couple other things. We're looking for people that are emotionally intelligent. Can you read the room and walk into that patient's room that just got a diagnosis? How do you handle that emotionally and be sensitive to the patient's needs? Do you have a little bit of grit? Can you get through a tough shift with a full load of patients? There's a lot of support here, and there's a lot of resources. And I think, I can speak for my team and Lichelle's team that all of the staff definitely have each other's backs. But, are you a contributing team player? Do you have great teamwork? Are you teachable? even if you have oncology experience coming into a new institution and a new unit, there will be things that are different. And are you going to be able to adapt and learn to this, this new industry? In terms of people applying from a new grad position where maybe, they don't have that opportunity and they're just entering their nursing career, did you do your clinical preceptorship in oncology? Do you have any precepting experience when you did your clinicals in oncology? Did you gravitate towards that population? Do you have experience with taking care of patients for long term or developing relationships for long term? Did you do any volunteer work? Did you have maybe a loved one or a family member that was impacted by cancer? Then maybe you understand a little bit more what that population goes through. I think overall, anyone, what we bring to the table really builds the team. And I think it's important to have a diverse team and not have the exact same resume over and over. But I think, there's a lot of great applicants out there. And I think it's important to be able to speak to what they bring to the table and how they would be a great fit for us.
Thanks so much, Casey. And I'm looking at some of the comments. So for those of you that are interested in new grad, our applications did open yesterday. The link is on our career site. It's on all of our social media sites. So you can click on there and apply. Applications are being accepted for the next 2 weeks. Interviews are in January with the cohort starting in March. And there is the option on there for inpatient oncology BMT for those interested. For the experience side, I'm going to let Jennifer Delgadillo, my talent acquisition partner here, talk a little bit about, for those that are experienced, we have a hiring event coming up next week where you can chat with our hiring leaders within oncology. Jen can give you a little bit of background on what we're looking for those of you that are interested in attending, and also dive in a little bit more about what are the benefits we offer, sign-on relocation that we offer, and different ways to get involved here with our employee resource groups. So Jen, hopefully that's not too much to lay on you, but we'll pass it over to you.
Hi, thank you, Carly. Yeah, so we are actually going to be having a oncology nursing event on November 8th. It'll be from 11 to 2. We're going to have our oncology leaders conducting on-the-spot interviews. And what we're looking for, obviously, ideally, an experienced oncology nurse with chemo certification and OCN. But like our leaders, Lichelle and Casey were saying, we're also open to those nurses that are just looking to join our oncology team and, maybe they don't have experience but have thought about the specialty in the past. What we're looking for as far as those nurses that perhaps don't have that experience is a minimum of 1 year in a hospital setting. Preferably you've done step down in the past. I also review resumes that, have done outpatient infusion in the past, because that just kind of shows some interest in oncology. I am generally looking to see if you have, what on your resume shows some kind of interest in oncology. Have you participated, maybe in, during your internship? Did you do anything where you were involved in oncology and things like that? So that's kind of what we're looking for. Don't shy off if you don't have the oncology experience. Still come and join the event, because we are obviously open to training, but definitely you must have at least a minimum of 1 year hospital experience to join. As far as benefits, we offer very competitive benefits: health insurance, which is paid by Stanford, dental and vision. We offer a retirement plan where we offer up to 6% match. We have mental health resources for our staff. And we also offer housing assistance and relocation assistance for those candidates that are relocating. We have a 10K bonus for some of our oncology departments. And we also offer very competitive salaries, as well as offer a quarterly bonus for those nurses that are certified. And eventually within 6 months, you will need to, if you're hired in a unit that administers chemo, you will need to obtain your certification. So you will be eligible for that bonus for sure. If you're unable to attend the Brazen event, obviously you can always message me, send me a private message via LinkedIn. You can email me, and I believe we'll go ahead and add my email address on this event so that on the chat so that you guys can reach out to me. You can also check out our positions on our website and apply directly. I review all resumes, and generally all resumes are forwarded to our leaders to review. So please make sure that you do attach your resume on the application. Otherwise, the application doesn't get forwarded until I do receive that resume. Yeah, that's anything else?
That sounds good. Thanks, Jen.
Yeah.
And I just had a question come in. Casey, Lichelle, I know it's going to vary per unit. So Casey, I'll start with your unit. We had someone asking, do you guys have any day shift openings? Are you hiring for night shift? Is it rotating available? And what does rotating encompass in terms of shifts?
Yeah, great question. So on E3, we have straight days, rotating, and straight nights. Right now, we do have positions open for rotating and for night shift. So night shift is, it's 3 12-hour shifts. So we start at 18:45 and go to 7:15. And then you work every other weekend. And then rotating, so you do days and nights. So day shift is the inverse of night, so 6:45 a.m. to 7:15 p.m. We really try to do what the preferences of the individual staff member. Some people really love nights, some people really love days, some people like a mix of both. So we try to do what people like, but also we do need to meet the needs of our staffing as well. So most of our staff in a rotating position, maybe they prefer day shift. So maybe they'll do 6 to 8 months of day shift and then maybe about a month of night shift and then switch back. Very subject to change based on our staffing of our unit. And then we have some rotating staff that are that really prefer a night shift. So they mainly do night shift and then maybe they come back to do day shift for a few shifts or a month or so. I think it's nice to have that flexibility. It certainly helps the staffing in terms of, we really want to make sure that the unit is staffed well. And I think it also makes you, it's important to understand both shifts and you learn different skills on both. We do have positions, straight day shift is a coveted position. So we do offer those positions to more senior staff when different positions open up. But yeah, I think right now we are hiring rotating and night shift.
And just to add to what Casey says, we try to make it work, right? So if it is within our nursing template or in our hiring template, if it is that you might have a need, if you have certain, specific life-changing events that has happened and you want to make a switch from nights to days, we're quite flexible to see, if it is that we can accommodate such a move, we're quite flexible to honor your request. And so I have an example. I have a member of staff that had a baby, is on night shift, and the arrangement just is working out with childcare and with his home situation. And so for us, we try to make it as comfortable as possible for the staff because, we invest in our staff and we do recognize that these things can happen. And if it is that we can make the move to accommodate our staff, we will. And so these are some of the examples that I have to share still how we try to staff our unit. And in terms of working days or nights, it's up to the preference of the staff. For my unit specifically, we have just a few rotating shifts, but predominantly the staff pretty much selects either days or night preference, whichever works. What I can say definitively is that we try to work with the staff where they are. If it is that there is a need that has arisen or has arisen, we can go ahead and make a plan that fits the staffing needs and fits the staff plan as well. I think overall too, we have that flexibility to scale down our FTE commitment, and that's always a plus. And so we do have a unionized group that does help to shape the benefits of the staff or the registered nurses on the floor. And so with that said, we try to stick to an 80-20 percentage. And so 80% of our staff does work full times, whether it's days or nights. And we do have that 20% that has the opportunity to switch over to part-time. And that is a favorite selection, if you may. And so, of course, as Casey alluded to earlier, we do use a seniority rank to determine, the eligibility of such positions. But these are some of the options that we have in front of us. I wanted to share something, quite specific, or wanted to piggyback from a point that Jennifer made as it relates to hiring, and not just hiring for my unit or for Casey's unit, but overall. And we look at the total profile of the candidate in front of us. I just wanted to share that, listen, for me, my last 5 hires didn't have oncology background. And so we're willing to go ahead and train such a person, whether they prefer to come over on the day shift or the night shift or all shifts. We do have that capacity to train and to have seasoned preceptors go ahead and introduce them to the Stanford way of practicing and the protocols that we have in place. And we do try to make the work environment a little bit more tenable and comfortable, and try to provide the resources that each staff needs to succeed.
Thank you for that, Lichelle. Jen, I had a question come in that looks like it's right up your alley because it's tied to benefits. Jane asked if we offer tuition reimbursement, specifically for new grads, but since new grads are hired as clinical nurse ones all the way through, as a clinical nurse, what do we offer in terms of that? Do we?
Yeah, we actually offer up to $2,000. It's an education reimbursement, and it's paid as a form of either you can apply it towards current loans, or you can apply it to any new education that you're going to be obtaining.
Awesome. Thank you. We had another question just come in. So Lichelle or Casey, I don't know who will want to take this, but Patrick asked, do you have a particular format for training staff into administering chemotherapy, immunotherapy? Is it precepting, classes online? How does that work?
I can speak to that, Carly. Yeah, great question, Patrick. So for our, and I'll answer this in preference of a staff member that maybe does not have oncology experience. If we hire someone with oncology, it's a different pathway. So if you don't have oncology experience, usually we'll start you off with about 3 weeks of orientation with a preceptor. About 3 to 4 months after that, we'll have you do a chemotherapy training day with our clinical nurse specialist and our unit educator. Then you'll get 3 shifts of orientation with a chemotherapy super user to get signed off on non-vesicant chemo. In a couple months from that, you'll get signed off on vesicant chemo, which is a different type of chemotherapy. Throughout that process, we also have oncology training classes that are offered through our Center of Education and Professional Development. So it's a continual education process to understand how to take care of our patient population more in terms of symptom management, oncologic emergencies, and different things that are specific to the oncology training patient population. Throughout that, even we're checking in with you. We have educational professional development specialists that meet with you and are available if you have any questions or if you need assistance. So it's a very well-structured program. C2 actually had it implemented throughout their conversion from a medicine unit to an oncology unit. So a lot of resources, a lot of education, a lot of things available for a staff that's learning a new population.
And just to add, just to piggyback on what Casey just mentioned, we do have a brand new oncology fellowship program that was started in August of this year. And so this program is designed for nurses that really doesn't have that oncology background. It's a 9-month program that does entail a whole lot of didactics. We do have classes delivered from or by our seasoned RNs. We do have our medical partners or medical practitioners partnering with us. We do have our advanced practice APPs or nurse practitioners delivering some of the course material as well. And this is a real good setup for our newer nurses who really are interested in learning oncology, who really are excited and motivated to deliver that optimal care, but does need that support in getting the the psychomotor skills and in getting that cognitive skill set developed and the decision-making component developed as well. And so currently, if it is that we have anyone here that is really, not so strong in terms of delivering oncology care, but they're interested, we do have the resources. It's really run by the Center for Educational Professional Development, the CEPD, which is a department that is focused just on training and developing our nurses. And so you're in good hands as it relates to the teaching partners that we have available. And in terms of having a structure, we do have a solid one to offer all the resources that we need.
Thank you so much, Lichelle. It's exciting to hear that there is a program in place now, because I know oncology has become a unit that I've had a lot of talks with different nurses that they want to cross-train into it. It was just a matter of how or where would I need to go in order to do that. So excited that we are leading that here at Stanford. For those that are watching, Casey, I'll start with you, and then Lichelle, I'm going to pass it over to you as well. For those that are, considering an opportunity at Stanford, looking at our oncology department, what would you say to them about why give Stanford a shot? Why did you, obviously you're here and you've stayed here. What's made you stay? What's made you enjoy coming to work every day and getting excited about being an employee of Stanford?
Yeah, that's a great question. So, a little backstory. In high school, I worked at an ice cream shop, and we served ice cream at Stanford's Nurses Week. And when I was in high school, I was like, you know what? I'm going to work here someday. It's going to happen. And here I am several years later. So, the reason I stay at Stanford is definitely a great place to work. There's a lot of resources. I think what really gets me excited and gets me out of bed in the morning is the patients and the people and the staff. There is nothing like connecting with a patient in oncology. There's a lot of beauty and a lot of different specialties, but I think oncology patients have a different comprehension of their disease and a different appreciation for nurses. So, it's kind of a thing that it gives back to the provider to provide good care to someone. I really love working with my staff. I think each and every one of them offers something special. Each and every one of them are amazing care providers. They have very different backgrounds of how they got here, some from oncology, some not. And I think I love seeing the teamwork that they all bring today. It's encouraging to walk out of my office and see people comforting a staff member that's had a busier shift, or, remembering someone's birthday, or we have a staff member that's vegan. And so they're very intentional about bringing vegan food to their potlucks. It's the people that make a job. You can work anywhere, right? Nurses are there's a lot of variety, there's a lot of jobs, but the people and the patients really make the difference in where you work. And that's why I stay.
I agree 100% with Casey. Looking at our NDNQI scores for last year, one of our top ranking metric was the RN to RN communication. And I could probably say that I do feel satisfied with the level of collegiality and the level of trust and the level of connection that we have as a team. And I think of top priority, my team culture makes a difference. And I think how we communicate and how we share and how we trust each other and how we really open up person to person does make the difference. And it's really that salient point that brings me back to work each and every day. We have so many options now, and why I choose to stay really at Stanford was really based on the interactions that I have with my team. So we have a quite diverse group of nurses with various clinical backgrounds to share. And so likewise for myself, I grew up in the era of nursing where you had to be quite strict. You had very strict teachers. And, in order for you to become a nurse, you had to prove yourself above and beyond. And there was no scope for you to identify your mistakes. Or if you do, there was such a heavy burden of, boy, I didn't do what I was supposed to do, or I failed, or, that overwhelming feeling of not being well or not doing enough was really my experience as a younger nurse. But what we do have here at Stanford Stanford is really that just culture that really looks at various influencers to our nursing practice. And so if it is that a staff makes a mistake or practices below a certain standard, they feel quite emboldened and encouraged to say, hey, Lichelle, this is what happened. This is what was done. How can I make my practice better? And, that openness really seals the deal for me. And we recognize that these things might happen, but we pave the way for our staff to be quite reflective. We pave the way for our staff to have accountability for their practice. We pave the way for them to introspect and to see what could have been done different from their point of view and what I can do to assist with removing some of the system barriers in front of us. And so looking at that line of communication and looking at how we really interact is a strong point that keeps me coming to work each and every day.
I love that. Jen, I guess I don't want to leave you out. So obviously you're not on the nursing floor, you're over in talent acquisition, but I know that there's all these different ways for nurses to get involved here, to become a part of the Stanford community and different events that we offer here on the campus. Are there a couple that you can highlight for anyone that's looking to see what else they could become involved in here?
Yes. Yeah. So we actually have different resources and ways that our staff can get involved here. We offer employee resource groups such as working parents, emerging professionals, Black Nurse Associations, which was actually founded by one of our own, which is Dr. Michelle Williams. She's our executive director for our research team. We also have Latinx, women group, and LGBT, just to name a few. And then a really fun event that we offer as well is Pause Days, which is Pet Assistance Wellness Dogs. And it is a Cuddle for Caregiver event. So those are just some of the events that we have here.
I think that would be my favorite day to come to work, is if I could play with the puppies.
I know.
Well, we're starting to get low here on time. I appreciate everyone's questions that they've been coming in. And again, we do have the hiring event next week. Lichelle and Casey will be some of our nursing leaders that are present. We are hiring across all of our oncology units: oncology, BMT, oncology, hematology, medical oncology, all with great leaders, great mentors. I can't speak enough about our oncology department. They are just every oncology unit is run by, I think, some of the best nursing leaders in the country. They make such a cohesive unit. They make their team members feel like family. I've been lucky enough to partner with Lichelle. I've been very lucky to partner with Casey's manager, Lisa. They make you love your job. They are there to support you at the end of the day. Anytime you're having a bad day, they want to help make it better. They want to make sure that, in order to be a successful nurse, you have to take care of yourself first. And they're there with as many resources as they can give you. And just truly a great team here in our oncology department. So before we signed off, I just wanted to give Lichelle and Casey both a chance. If there's anything else they just wanted to mention, anything at all, ladies, if there's just one thing you want to leave, about your unit or about working at Stanford, anything that just coming from the heart, why you think someone really truly love coming to work here at Stanford. Casey, I'll start with you.
Yeah, thanks, Carly. I think Stanford is a great place to work. I would want to encourage anyone to apply. I think sometimes we see Stanford and we see a big institution. It can be a little scary, but we open our doors to all types of applicants. And I think as long as you can speak to the wonderful work that you've done as a nurse, this could be a very great home for you. So would encourage you to apply, invest in what you're passionate about. I think that passion carries over to other people. Again, I think this is a fantastic place to work, and we just want to hire more talented nurses here. Thank you.
I agree. And if it is that your intention is to give the best care you possibly can, if it is that you want to work with one of the best systems in the nation, if it is that you want to live your life's dream of caring for persons, if it is that you're a people person, if it is that you want to grow and if you want to succeed and if you want to develop to your highest potential, consider us your home. We're here for you. We have all the resources that you need to build on, to stretch, and to really develop into the best possible nurse you can be. Consider us. We're here for you.
Well, thank you to Lichelle and Casey for joining us today. For all the various streaming channels that you are watching from, whether you're on YouTube, or you're on LinkedIn, you're on our Facebook, you're on our Twitter, I will go through and make sure that I put Jennifer's contact information. Should you have any questions, want to chat with her more about openings, I will also make sure to put a link to our oncology landing page on our career site. It's a great resource. It will have this video saved on it, but it will also break down the different oncology units that we have here, the number of beds, patient to staff ratio, talk about the type of patients that you'll have on those units, certifications needed for those particular units. There's also some great photos to show our teams at their various team building events that they do here at the hospital, as well as outside the hospital. And I will also include a link to our hiring event next Tuesday. If you are so inclined to chat with one of our nursing leaders, I encourage you to sign up so we can get you a reserved time slot to learn more about us. But again, thank you to everyone that came to chat with us today. We had a great time and we hope to see you on the next Stanford Live.